Thank you so much for joining me. I'm launching a new YouTube channel. It's called Audiology Made Simple. I know that this intro is a bit stark in terms of the black and white presentation. For those that have attended any of my talks, you'll know that I tend to be very visual and very kind of concept oriented. So bear with me. My name is Christine Carter. I do have an SCD with my C's in audiology. I'm a clinical audiologist and I provide services in a large East Coast hospital that has ENT services on site. I'm not going to mention the name of the hospital here, just simply because the information that I'm sharing, it's fundamental concepts within audiology. It's not specific to this particular hospital nor our protocols here. The SCD degree tag is an older tag, and basically it just means that my doctorate had an emphasis on clinical practicum and also clinical research. I started my CFY in 2003, and I've been working full-time as an audiologist since 2004. I currently work with neonates all the way through the elderly. I provide services in everything from basic audiological evaluations, including pure tone audiometry, speech testing, and admittance testing, to all kinds of devices. So hearing aids, bone conduction, remote microphones, also cochlear and auditory brainstem implants. In addition to that, I'm also provide electrophysiology services, which includes OAEs, electroneuroenography, so ENOG, CVEMP, intraoperative monitoring, and diagnostic and threshold ABRs. The one area that I'm not actually overly interested in, and I do not provide services in, is CAPD testing, tinnitus services, and also vestibular. There are other people that probably know a lot more about these things. It just doesn't happen to be an interest of mine. As far as why I'm creating this series about trying to make audiology simple, first and foremost, it's really to help audiology students or anyone hoping to provide hearing health care. Personally, when I think about myself as the student that I once was, I don't think I was a very good student. I had a hard time putting all of the pieces together. I was excellent at memorization. I could regurgitate word for word what I had read and seen, but I really had a hard time and didn't feel like I had the immediate support to put all the pieces together until I was actually in my clinical practicum. And I owe a lot to my mentors and to my supervisors who really helped make this logical. They put the pieces together and showed me how everything relates. And I feel that that particular approach continues to be missing from a lot of the education of incoming audiology students, as well as some of the audiologists who are fresh out of their fourth year. They're still having a hard time with some of these concepts. Does that mean that they will not become good providers? Absolutely not. Some of our best and most gifted audiologists actually came in with difficulties understanding some of the basic concepts of masking. And I think it's more a reflection of the failure of the educational environment. So I'm hoping that this series really helps with some of those concepts within audiologists in audiology that a lot of us struggle with. The other big incentive of this series really has to do with global outreach. Not all countries have audiologists. In a lot of cases, you have hearing health providers and physicians who are expected to be kind of a jack of all trades. So in many countries, it's the physician who has to do all of the diagnostic testing, and they're trying to learn that in addition to learning everything else that a physician has to do. And it's really hard to have the, time and resources to go out there and learn all of this material. Not to mention the fact it's hard to come across good material that immediately makes it visual and easy to understand. So I'm hoping that this series really helps a lot of those people out there who are trying to help others. So I feel that this is particularly important for the global outreach because there's this big push towards buying technology, and technology is fantastic. But while technology advances, not everyone has access to that. And there's many providers out there who may be working in areas where they have limited resources. And so much of this series is about making the most out of what you have. Also, I've myself have been in the situation where I have technology, and whether it be due to planned obsolescence or just failure of the equipment from working, I think it's absolutely necessary that you know all of your various ways of cross-check, and that you kind of really maximize your ability to use the simplest of tools to the full depth at which you can do so. Some of the examples of topics that I already have ready for a presentation and I hope to put onto the YouTube series is making masking easy, also estimating bone conduction in the environment of maximal conductive components and masking dilemma. For the outreach section, I know that there's limited information in regards to minimal data points. So if I have a pediatric patient with limited attention, there is a hierarchy in terms of what frequencies and what pieces of information have the biggest impact on how I can counsel that patient and how it impacts kind of my view of how quickly we have to step up our services and get that patient hooked up. I'm also going to present on behavioral testing, specifically for the population that's under 5 years of age. Working in various environments on the global outreach, I've had a number of kind of surprising interactions where, for a lot of providers, unless a child can raise their hand to stimulate in a basic hearing test, if that child can't raise their hand, then they're essentially deemed untestable. And so the options being either complete a threshold ABR or wait until the child's older. So I think it's important to share ways of obtaining data in the under 5 population. And sometimes that means that we may be testing them using a little bit of a different setup than what we use here in the States. And then finally, also present some information on threshold AVR equipment. I wouldn't exactly say this is gold standard. This is when you're in a situation where perhaps you have second-hand equipment that's unsupported. So you're trying to go out of your way because it's what you have in front of you, it's what you have available to make sure you understand how your equipment's working, making sure there's no internal noise, and trying to provide the best services that you can with what you have available. As always, with any of these YouTube videos and channels, please like and subscribe for more videos. I've developed a lot of these videos because I'm passionate about what I do, and liking and subscribing kind of demonstrates that the information is being received out there. I do work a crazy amount of hours, just trying to meet the needs of my own patients. And so it's nice to know that people find the videos helpful and instructive. I feel like I have a lot more to share, but I kind of need a little bit of encouragement to take the time to get those presentations ready. And it's nice to know that work, especially on this platform, is being used and it's being received, and hopefully people find it helpful. So thank you, and I look forward sharing more.